cover like the basics of TNR, and then at the end I have some cat behavior stuff that we can talk about if we have time. So I'm kind of working under the assumption that you've already got a veterinarian that can do the surgeries, because trying to find a veterinarian is a whole other type project. So I'm kind of working under the assumption that you've got that, and that you've got volunteers, and that you've got live traps. So I guess we'll just sort of start out with what is TNR, or it sort of more modern terminology is TNVR. So TNVR means trap, neuter, vaccinate, and return. The return part is important. It's not just release. You don't just trap them and let them out anywhere. You return them to exactly where they came from. And the V part, vaccinating, indicates that it's more than just a spay and neuter. So there are some groups that don't do vaccines, but it's becoming more and more common. And the importance of vaccines at the time of the surgery really can't be understated because of the public health risk of rabies. So they've added that R in to sort of capture that public health aspect of the rabies vaccine. And starting on January 1st of next year, it will be a requirement for state law for all cats to be rabies vaccinated. There is an exemption for feral cats unless they are part of a trap, neuter, and return program. So if you're just feeding a feral cat, it doesn't have to be rabies vaccinated, but if you trap that cat and take it to a veterinarian, it does. And so that's January 1st. And then the other vaccine that is strongly recommended, but is something that can be kind of done at the vet's discretion, or perhaps it might not be in your budget, is the FERCP vaccine. I don't know if you guys have seen any panleukopenia in the area, but it's been kind of going around central Illinois. We've seen it for the last few years.
Can you describe what that is?
Yeah. So I'll just start with the vaccine. The FERCP vaccine is feline viral rhinotracheitis, calicivirus, and panleukopenia. So rhinotracheitis is kind of your typical upper respiratory infection in cats, also known as feline herpes. It can be a chronic condition, but more often they get it and they get over it. The calicivirus is, it can cause some upper respiratory symptoms, but it also causes joint pain, high fever, lesions on the tongue. We have seen some really nasty calicivirus this year, cats that were sick for weeks and weeks. And then panleukopenia, is probably the most fatal of the three diseases that are covered by that vaccine, and that is essentially parvo in cats. So you can test for it using a parvo snap test like you would for dogs. It is spread through feces, and it is highly contagious, and especially in kittens, it is often terminal. We treat a lot of panleuk cats in our shelter, and I think we lose far more kittens to panleuk than we do dogs to parvo. Yes. And it's hard to get rid of, and so
what symptoms do the kittens show? Like
vomiting
if they came in
and diarrhea.
What?
Yeah.
Vomiting and diarrhea.
But not
Both at the same time? Or?
No, can be one, could be the other. We see bloody diarrhea, we see regular diarrhea, we see, sometimes we don't see either one of those and they still have panleuk, but pretty much for us, anything that vomits or has diarrhea, we test immediately. And then quarantine and provide supportive care. So that's something that it can wipe out an entire kitten room in a very, very short time. Very, very contagious.
Jacksonville town lots of cats and kittens over it.
Yeah. I had not seen it 20 years until maybe 4 or 5 years ago, and then it showed up with a vengeance.
Mm-hmm. So. And I think that it's kind of like more people know about it than they did. Cass County vet clinic published something on their Facebook page, and a lot of people saw it and started calling about getting their cats vaccinated. So it can affect adult cats too, and it's important to even have indoor cats vaccinated for that because you can bring it in on your shoes.
Can you tell me the initials for that one more time?
Yeah, it's FERCP, or feline distemper vaccine. One note about the feline distemper vaccine is it's important to use a modified live vaccine instead of a killed vaccine. And that is because the modified live vaccine doesn't require a booster vaccine to be as effective, whereas the kill vaccine requires a booster within 3 to 5 weeks. And another good thing about vaccinating feral cats for distemper is that they will spread some of, they'll pass some of the vaccine particles in their stool, and the other cats in the area will pick that up, and they will start to develop sort of a secondary immunity because they're picking up that vaccine from the other cats. So you don't even have to vaccinate all the cats to start seeing a protective effect from that vaccine. That was something I just learned, and that was really neat. So,
Well, thank you for sharing.
so yeah. Another crucial part of TNVR is ear tipping. You've got to ear tip the cats. The standard is left ear tip, about 1 centimeter or maybe 1/3 of the ear. And we always do the left ear. It's most places do the left ear. Sometimes you'll see left for one sex or right for another sex. But for us, we always do the left, and that's because you can see frostbite that looks like an ear tip. We turned away an ear-tipped cat one time, and she had babies. If we get anything in and we're not sure it's an ear tip, we will still knock it out just to make sure that it is fixed. Because you would think that there would be frostbite on both ears, but she tricked us. Some people, you'll get some pushback from the public on the ear tipping because they don't like the way it looks, or they think it's inhumane or cruel. But it's really necessary so that you can tell that the cats are fixed. You don't want to keep trapping the same black cat and bringing it to the vet clinic and anesthetizing it. If you're going to lose a cat in surgery, you're probably going to lose it to the anesthesia as opposed to an actual surgical procedure. So you really want to limit having to bring cats back in if you can. Another thing to consider is microchipping if you want to microchip the cats. We do that in our county. We started doing that several years ago when our county started requiring rabies registration for cats. And our county permits us to microchip the cats, and then the caretakers are exempt from having to register the cats with the county. You really don't want to have to register feral cats with the county because it can dissuade people from bringing the cats in. If they have to pay for it, it's an additional cost. But some people are afraid to register cats with the county because then if there's a limit in how many cats you can have, or if you're not going to vaccinate them every year and the county charges back tag fees, if you don't vaccinate your cat for 5 years, our county is going to expect you to pay for those 5 years when you go to register them again. So we have
How much is that registration?
It's $17 in Sangamon County.
A year?
$17 for 1 year or $34 for 2 years. So they cut you a break.
And that's for a feral?
Well, that's for an owned cat or dog. So they're just exempt from registration in our county. So as long as the cat is part of a managed colony and has been fixed and vaccinated and microchipped and ear tipped through our program. So we worked with animal control to come up with that agreement. The cheapest microchip we can find is $4. So you have to take that into consideration. That if you're, we charge $25 for a surgery, and so $4 of that goes directly to the microchip company for the microchips. The good thing about the microchips is that if the cat ends up in animal control, we can get it back to where it came from. And that saves us from having to put the cat in our barn cat program. It saves the cat from having to sit in animal control for 7 or 10 days while it goes through stray hold. So right now, if animal control gets an ear-tipped, microchipped cat in, they call us, ideally the same day. We go pick up the cat, and oftentimes we just go drop it off where it came from.
So when you say you microchip the feral cats, it's you put it to a TNR program?
It just traces back. Yeah, there's no registration with the chip company.
Right.
We just
But it that way everybody knows that you guys own it.
Yeah, yeah. Animal control sees the chip number and the ear tip, and they know it's ours, and they just call us, and we plug the number in the system. We will try to call the people usually to make sure that they're still there and feeding the cat, and most of the time the cats are from a trailer park, and we know that there's probably multiple people feeding them there. So if they're friendly, then we'll keep them and place them for adoption. But
Now is though, you microchip just for your county.
Yes. Mhm.
So now, if anybody brought it in from another county, they would have to ask to have it microchipped.
Yes, mhm,
Okay.
yeah, but we include that in the $25 package for cats in our county. And, I'd say we get a cat like maybe once a month with a microchip. So, yeah, it's, you know,
More
it's
often,
kind of,
I mean, I wouldn't have thought that, so.
yeah. We had one just right before Thanksgiving. The cat was friendly and had actually been at animal control, like 3 different times. And, but he wouldn't stay inside, so, we just keep taking him back to where he came from, so. An important part, of TNR is not just trapping feral cats, but getting all cats, community cats included. So, we consider anything that's living outside or predominantly outside as eligible for our feral cat program. So we'll get friendly cats, we'll get friendly kittens. We feel like if it's outside, it needs to be fixed. And most places have got a leash law right now, so we don't get overly concerned about whether it's someone's pet or not. Because if it's outside, it should be fixed. And a couple of times we have had people who, accidentally brought in their neighbor's cat. But we haven't had anybody that was really upset about that, fortunately, so.
And can Sarah can you, differentiate community versus feral?
Sure, yeah. So community cat is kind of a catch-all for any outside cat, stray cats and feral cats alike. A feral cat is really like an unsocialized cat that is not approachable and, you know, not something that you're just gonna pet and throw into a cat carrier.
But a community cat, I mean, there can be tame cats.
Absolutely,
That live
yeah.
outside and live in groups,
Yes.
and those
Oh,
are
yeah.
called the community
Yeah,
cats.
yeah.
Okay.
And, so then as far as those friendly cats are concerned, one consideration you have to take when you're doing TNR is if you wanna put those friendly cats back outside or if you wanna bring them into your shelter. We generally recommend fixing them and putting them back outside, and there are a few reasons for that. First of all, if that is somebody's cat, the best way that they're gonna get their cat back is if you put it back where it came from. If you take it to a shelter, the person might not think to go to a shelter. You're essentially taking a cat that has a home and making it homeless by taking it into the animal control or into your shelter. The other reason is just space at your shelter. You don't need any more cats than you've already got, I'm sure. I don't think anybody in Illinois is hurting for cats. And so, since you really don't know the background of that cat, if you just neuter it and put it back out where it came from, it's obviously been thriving out there for however long it's been out there. We do on occasion take cats into our shelter that came in through TNR. Mostly that is little bitty kittens or cats that are sick or injured and are tame. We don't really keep anything that is feral in the shelter. No, even if it's pretty seriously injured, we usually try to find a way to get those cats back home, even if we have to hang on to them for a little while. And then you also have to consider, do you want to remove kittens? The goal of TNR is not to eradicate your cat colony, but to stabilize your cat colony. So, you know, if you've got cats there, you may always have cats there. And getting them fixed is gonna make sure that your numbers are not growing, but you're not gonna see a huge drop in numbers right away unless you've got a lot of kittens and you're willing to just pull those kittens and take them into your shelter. So that's one consideration before you get started, is having to have a plan for what you're gonna do with tame cats and especially with kittens. Because a big part of reducing those numbers is gonna be in removing friendly kittens. We have noticed, most recently we did a TNR project at University of Illinois Springfield, and they started with maybe 30 or 40 cats, and that was last spring. They had 1 litter of kittens that we removed, and we fixed about 20 of the cats, and now there's only 10 cats left. So, you know, within, you know, a year and a half, we saw those numbers dwindle quite a bit without having to remove very many of the cats. And we had agreed to remove any tame cats if there were, and there we ended up with, I think, a couple, so. And just of note, there was a study released very recently, that found that high-intensity trapping was actually the most successful method of, saving lives of cats. So that takes into consideration cats that would come in and get euthanized and cats that would die on the streets. So TNR not only helps with just overall cat numbers, but it really improves the lives of the cats themselves and prevents suffering. Does anybody have any questions on sort of the basics? Oh, yes, yes, maybe I'll talk about that in the medical.
I have one question.
Sure.
Some of the cats that actually have ended up at my house at my feeding station, which is on the back patio, I mean, they won't let you pick them up. Okay, but they've been feeding there for so long, they'll rub against your leg and they'll touch you and all that stuff. But there's a couple cats last year that came and they were there all the time. One was very tame and even had her kittens on property. But it was like, I knew she came from somewhere else, you know what I mean, in town. But how would you know?
Right.
And I ended up getting her fixed. And then I was worried about the legality. I mean, a tame cat is somebody's. But of course, then they drop so many off. People just go through the country and just drop off cats. And they tell each other, they've got a signal, there's food over here. Food. So do you know what the legality is if a cat's always eating at your house?
So if you live somewhere with a leash law, the cat shouldn't be off leash anyway, and so, if the worst thing that happens to their cat is that it gets picked up and fixed, I feel like that's a pretty good outcome.
Okay.
If you're letting your cat outside, then there's a whole score of hazards.
Right.
And so, getting the cat fixed and ear-tipped is probably, I think, pretty low risk. Animals are also considered property, so you're kind of looking at like what's the value of a cat. And so if we
More than a
spay,
human, unfortunately.
if we spay the cat and it can't have babies, how much money could you really have made by selling a random domestic short hairs cat's kittens? And so even if they did try to sue you, like how, they would have to hire an attorney.
Under Illinois law, if the cat's on your property, it's a stray cat, and you're holding the cat and you're feeding the cat, that's up to you because it's on your property. It came there as a free will.
Right.
Under Illinois law, unless the person who owns the cat can prove they own the cat, they can't just come up and say, that cat's mine, I'm gonna take it. If they have pictures on their phone or something, yeah, that's obviously the cat. Yes, legally you have to return it to them. Other than that, they're just,
Oh, I would.
they are property.
It's just
They have to be able to,
Yeah.
right, but they have to be able to prove it
Yeah.
first. So if they just come up and say, that's my cat, ask questions, cause you never know.
What can you do with the cat if you don't want to just feed it?
If you don't wanna just feed it,
Yeah.
don't put
Take
food
it to the
out.
animal.
Yeah, take it to the animal control would be the first place to go, yeah.
We don't have anybody in Fayette County that accepts cats right now.
Really?
Rescues.
Well, that's pandemic.
That's kind of rough.
Sarah, what about leaving the trap out? Like I was talking earlier about, I worked long shifts, several in a row, and then I'll have a bunch of days off. And it's hard to leave a trap out and you don't have anybody else to monitor it. How long would you leave that cat safely, say in the winter?
Sure. I will go over that. So, I will make sure and touch on that, kind of once we come to it. So, okay, well, I guess now I'll kind of move on to like the supplies that you need to get started. So you need live traps, and we brought a couple of different live traps. We bought a regular box trap, which is this, and then we bought a drop trap, which hopefully I can show you how to use because it's pretty neat. And it is for those like difficult to catch cats that just won't go in a live trap. You might want some cat carriers in case you've got friendly cats. If you can put friendly cats in a cat carrier, it's gonna be easier than waiting for it to go in a live trap. I also brought what we call a Heidi box, which I'll show you at the end, or a feral cat den. Having a couple of those is good in case you get a cat that you need to hang on to, that's like injured or maybe has babies. Actually, I should just get that out right now and show it to you guys. So, this is a feral cat den, and we just got these about a year ago, and they are amazing. So these are meant for if you're going to be housing a cat, and you can also transport the cat. So this slides up, and it's got air holes on the side, but then also this bungees. And it opens like that. So if you've got a feral cat that you are housing, this works as a house and a carrier. So you can put the cat in from the front, and then close up the front and then open up the side. So while the cat is living in the cage with you, it can go in here and you don't have to worry about trying to handle it. If you're cleaning, you can just shut this, you can pull this out, you can take the cat to the bed in this.
What's something like that cost?
$60. And these are, I just can't say enough about these. I wish we had had them much sooner than we did.
So when do you, excuse me, so when do you typically use those? You said injured, a cat that's injured?
We primarily use them in our barn cat program if we're holding cats that are sick. Or if we have a foster that has a feral mom with babies, because you don't want to separate those babies. You know, if you've got 3-day or 3-week-old babies, you want to keep them with the mom as long as you can, 6 weeks at least. And this will help keep your foster from getting bitten. They're wonderful.
You can write
Now-
grants for these pretty easily, for
Yeah.
these and for feral
Yeah.
traps, so that's
Now-
how we've gotten a lot of them.
Now, can you, like if you were using one of the other traps, okay, like that trap,
Yes.
is it easy to then get the cat to go in that one, from that one?
It's easier to get cats to go from a smaller space into a bigger space.
Okay.
Usually when we are using the Heidi box, we're putting the cat in the cage while it's still anesthetized, or at least partially
Okay.
anesthetized, because you know at the time of surgery if you're gonna hang on to that cat. Or if you've got, a cat that's gonna go to foster, it's probably coming to you in a crate, and so you can send the Heidi box home with the foster, and they'll shoo the cat into the cage, and usually they will go directly in there. The cats just wanna be invisible, and so they'll go straight in there.
Now, just so you guys know, the way we do this is the person that has the colony, they're responsible for the trapping. We've got to deal with all the vets in the county, and they'll call me in the morning, and then I'll call around to all the vets and see who's got an opening, and then I'll call back and they go over there, and so we don't even handle the cats. And then they just take them right back to where they were and drop them off.
So, okay, so I call you and I tell you I trapped a cat. So then it's my responsibility to bring the cat to that vet?
Yeah, I'm gonna call around and
Okay.
I'm gonna call Doc Sloan, and Doc Sloan's gonna say, yeah, we'll take that cat. So then I'm gonna call you and I'm gonna say, Mardell, we'll take that cat over to Animal Kingdom.
Okay.
And you're gonna do that, and then they're gonna take your number and call you back, and they're gonna put it back in the trap while it's still under, and go from there.
Okay.
I didn't mean to interrupt, but,
Yeah.
Okay,
It's
so that-
important to know
Do they-
that's how we-
Do you guys loan traps, or do they?
No, I
trap
don't
them
have
out?
any traps.
Okay.
And we looked at buying traps, and it was like, to get the number I thought we really needed, it blew my mind,
Yeah,
It was over like $1,500.
yeah,
so I
we've
thought,
gotten most of
"No."
our traps through grants.
Yeah. This is our favorite live trap because it has a back opening.
Yeah, that's the one we were looking at.
Yeah, we use tomahawk live traps. True Catch and Have a Heart are pretty popular, but this was designed specifically for a group in New York called Neighborhood Cats. And so they told Tomahawk what they wanted, and Tomahawk made that. So it has a back opening, so it's a lot easier to bait it and to get your cats in and out of it. It's got a nice big plate on the top so the cats, and they're not usually trying to get at you, but if they were, they really can't. And we always number our traps so that we can keep track of them. But really, any live trap will work. I mean,
So who makes the tomahawk?
Tomahawk is the company.
Right, but I mean.
That's the manufacturer.
I know, but
Yeah.
who carries it around here that we would know?
Oh,
Big R,
I've never
Walmart.
seen them in a store. We always
Oh,
order them
okay.
online. Yeah, but I mean, we will take cats in anything that people can get them in. So if you can get somebody to just give you traps, I wouldn't be picky about what kind of
Yeah,
brand
beggars
that you
can't be
use.
choosers.
Yeah,
Yeah, most of them
but
would.
these are good and sturdy. They don't hold up very well if you get a raccoon or a possum. But I'll kind of talk more about wildlife later. So,
We got a raccoon in ours.
yeah.
Yeah, we
So-
took it out to Sandhurst.
In addition to your traps and your hidey boxes and cat carriers, you're gonna want like tarps or sheets or towels. You wanna have a towel to cover every trap, because it helps, entice the cats to go in, and then if you cover it completely, once you catch the cat, you'll help keep it calm. If you've ever watched a cat get trapped, they tend to go in and then spin around in circles and bang up their nose sometimes. So if you can cover that trap, it'll help keep the cats calm. You're gonna want a newspaper because if you're holding the cats for any length of time, you're gonna want newspaper in the trap or under the trap or maybe both. You need canned food and something to put the food in, some kind of food trays. You don't need a lot of canned food for each trap, just a tablespoon or so. And you wanna use something smelly. Pate style is usually the stinkiest. You can use sardines, anything that smells strong. You want some kind of labels because you want to label each trap. Once you catch the cat, you give it a name and you want to mark the location of where you trap the cat so that you can return it back to where it came from. You want a notebook or something to keep a record. You might want to take note of all the cats that you see, or at least like kind of count them and maybe get some descriptions. That way you know how many cats that you've got in any given colony. You also want to record everywhere that you set a trap. If you are doing a big trapping operation, like more than like 5 or 6 traps, you don't want to forget a trap. Because if you lose the trap, obviously you could catch something in it and then never find it again. So that is very important to make sure you keep track of where you set all the traps. And then things you probably don't need are gloves and a net and a catch pole, kind of your normal animal control type tools. The goal is to not have to handle any of the cats. So if you really just don't even need those items. And unless maybe you're really experienced. But if you get bitten, then the cat has to be rabies quarantined, or it has to be euthanized and the head has to be sent in for rabies testing. So neither of those are things that you want to do. So just go in with a plan not to touch the cats. So then the next thing you want to consider is the location that you're trapping. If the individual is trapping themselves on their own property, this isn't really a major consideration. But if you're doing any large-scale trapping that's not on your property, or if it's on public property, you might want to notify the people that live there of what you're going to be doing. Like if you're going to go trap in a trailer park, you probably want to notify the residents that you're going to be doing that. And then if you've got people who do let their cats outside and don't want them fixed and ear-tipped, then they can keep them inside during that time. You also want to have permission from the property owner. You definitely don't want to get in a situation where you go and you set a bunch of traps and then they won't let you get your traps back. Then the next thing to consider is timing. Before you start trapping, you should establish a feeding schedule. If you get the cats on a feeding schedule, then they are at your mercy for food, hopefully. So get them on a feeding schedule, and then you want to withhold food for a feeding or 2 prior to trapping. That way the cats are hungry and they're going to be more enticed by the smell of the food and more likely to go into the live traps. Hungry cats are much more easy to catch. So you want to time your trapping for whatever time that feeding is. So most people have got a feeding schedule. A lot of people we talk to feed them 2 or 3 times a day. Usually trapping in the morning is best because then you don't have to worry about holding the cats overnight. holding them overnight just adds a whole extra level of work to that. So if you can get them trapped in the morning and into a vet that very day, it's gonna cut down on your efforts.
Doesn't matter that they've ate food.
No, well, it's not for us.
Okay.
And it is increasingly more common that it is not important. Cats, you know, I mean, if they vomit from the anesthetic injection, you're gonna be there to see it, and I don't know, I mean, we virtually never have cats aspirate on the table. So if it
That was
happens-
always a thought I didn't know.
Yeah,
They
yeah,
did
it's,
that.
I think it's still pretty common for vet clinics to say no food after midnight, but, we, you know, we've had cats throw up whole mice and stuff, I mean, you just can't, you know. And holding them is stressful, so
Right.
if you
Shorter
have a
the
clinic
better.
that doesn't want them to eat after a certain amount of hours, then, the longer you hold on to the cats, the more stressed they're gonna be, the more likely they are to get sick, so it's just kind of a risk that we take and is almost never an issue. So skip the feeding. Feral cats are most active at dawn and dusk, so if you are gonna be trapping, you wanna do it first thing in the morning or probably, like towards the end of the day. And then you also want to take in consideration the weather. If you've got a big trapping expedition planned and it rains, it's just gonna kill it. I mean, you're just not gonna catch the cats like you would want to. And if you have a whole bunch of appointments set up at a clinic, that's gonna make, you know, it's gonna complicate things, but, you know, check the weather and, snowstorms also not good for cats. Trapping in the cold is not really an issue as long as you keep an eye on the live trap. So as far as cold weather considerations, I think you want to make sure and check the traps more often when it's cold, but you can still trap in the cold and still release cats in the cold. The cats live outside, so they're used to it. If you are going to loan traps to your clients or loan to the public, you want to take a deposit on the traps. People are good intentioned, but they will still keep your traps. So if you take a deposit, they're much more likely to bring the traps back. And we always return the deposit. We just take a check and then give it back to them. And you should number your traps so that you can keep track of them, and just keep a log of where they go. And then finally, before you trap, you want to have a plan for complications. So we already talked about having a plan for tamed cats or kittens, but you also want to have a plan for cats that are seriously injured and need medical care that doesn't allow a next day release. And you want to have a plan for moms with babies that are too small to separate. If you catch a cat with very young kittens, you really don't want to release that cat because you might never catch it again. The more these cats see the traps, the more wary they get of them, and so if you actually catch a cat in one, you don't want to let it go. You can spay a cat that's nursing kittens. We used to do flank spays where you'd go in from the side so that you wouldn't interfere with any of the mammary, area. We don't do that anymore. We just do a regular spay, and like the cats can nurse, and as long as the babies are there, they're gonna keep producing milk.
And our vet had told, our vets had told us when I asked those exact questions, they had said that the kittens will be okay for a day, just, a day or so.
Yeah, that's how we
They'll
do
be
it.
okay.
Yeah.
We just,
Yeah.
But
if
that
they're-
made me,
if they're
it was like,
captured,
oh my gosh,
that's
I'm
the
so
whole
scared.
24-hour part of it.
Yeah.
you know?
If we get a cat in that is clearly nursing very young kittens, then we will do it early or as early as we can. And then we may even reverse the anesthesia so that they can go home sooner. That does have a little bit of an effect on the pain management because when you're reversing the drug, you're also reversing some of the pain management. But, if they've got teeny tiny babies, you really want to try to get them back out there as soon as you can. And we also will call people if we see that the cat is very recently postpartum so that they can start looking for those babies because if they can find them and keep them safe, that's best.
It's impossible sometimes.
Yes, yeah.
They hide them.
Yeah.
They hide them so well.
Now,
And-
when you talk about the traps,
Mhm.
like let's say you were to set them at night, what's the longest that a cat can be in a, let's say, and I cover it,
Mhm.
you know?
Sure.
How long could it be in a trap overnight?
It can, yeah, I'm gonna touch on that, cause you had a similar
okay,
question, so I'm
yeah.
gonna touch on that actually next.
And while you're still interrupted, Sarah, back to the scheduling, just something that I know we've run into here was somebody really wasn't thinking and they trapped a cat on like a Friday night or a Saturday night when the vets aren't open the next day.
Yeah.
So just, I know that sounds
Yeah.
silly, but
Sure, no,
it's
it totally
happened.
happens, yeah.
So just make sure it's
Um,
gonna, when you take them in, it's going to be on a work day.
Yeah, I mean, definitely, yeah, plan.
Sunday through Thursday.
Yeah.
Yeah, plan your trapping for when you can actually get the cats in, cause you don't wanna find out too late that, the clinic's gonna be closed for 4 days or
Yes.
something. So then, so we'll touch on that here in just a minute. So now we're essentially ready for trapping. You've notified the neighborhood if you need to, and you've got all your supplies and your volunteers, and you know when and where you're going. You wanna go before feeding time, as we've already discussed, and get those traps out so that the only source of food is out in those live traps. And you might wanna put signs on the traps, especially if you're, trapping in a public area, that say what's happening. We haven't had a lot of people that were concerned that we were gonna take the cats and not bring them back, but that is, a common scenario, especially in like trailer parks, because people can be really suspicious that you're coming in to just remove the cats. And so if you have a sign, that, you know, the cats will not be harmed and that they're gonna be fixed and returned and please don't touch, that can go a long way for educating people who don't know what's going on. So you put the bait in the back of the trap. You can put like a little trail of food in there if you want to, like just a little bit of cat food juice or something. Sometimes that will get the cats to go in more easily. I haven't really done that myself and we've been pretty successful, but sometimes you get cats that are hard to trap and that can help. So then you just set the cats and you set the traps and you give them some space. If there's a bunch of people around, the cats are gonna be wary of the traps and not likely to go in, they might not come out at all. We recommend that you check the traps every couple of hours if you can, which is pretty doable if you're doing it during the day. If you're trapping after dark, you wanna try to keep an eye on your trap the best you can, because if you catch a raccoon or a possum or even worse, a skunk, you have not only the issue of you've got this wild animal trapped, what do you do with it, but they can really damage the traps. You can see how this trip plate is kind of pulled up on one side. That's from something digging at that, very possibly a raccoon or a possum. If you do catch wildlife, we advise that you release them on site. I think you have to have a permit to relocate, and even worse, if you catch a skunk, you're not legally supposed to release it. You're supposed to take it in and they euthanize it and they do rabies testing. So you really don't want to catch wildlife if you can avoid it, and you can avoid the wildlife the best by trapping during daylight hours. If you are going to be trapping overnight, I think that's okay. We tell people all the time not to trap overnight, and I know that they do. So they'll be okay. It's just we recommend that you cover the trap from like maybe here back, and that helps keep them calm. It's also dark, and they're not going to see a bunch of people around. So if you need to set the trap overnight, that's fine. Just make sure that it's somewhere safe, and that and the weather permits. You know, you don't want to set it in the middle of the night during a snowstorm or if it's raining. But I think that's totally okay, especially like if you're the ones doing the trapping, it's easier to kind of make those gray area decisions as opposed to like if you're talking to a member of the public. We tell everybody not to trap overnight. We had somebody who show up at our door with a possum in one of our traps who had its teeth stuck in the trap.
Oh.
We had somebody who called a pest removal service who assured her that they wouldn't kill the raccoons, but they're legally obliged to kill the raccoons, so that's what they did. So we just generally advise no overnight, but I think it's, if you know what you're doing, that's fine. So once you catch a cat, it would be good if you can remove the trap right away. If other cats see what's going on, they might be less likely to go in the traps too.
They're very smart.
But at the same time, if you see other cats mingling around, and you've got multiple traps that you might just wanna give it some space and see what happens. It can take a while for the cats to go in, you know, they gotta smell it and then they gotta kinda get up the nerve to go in there and, but ideally you pull the cats as soon as you can, cover them, put them somewhere quiet. Don't try to touch any of the cats. We've already kinda gone over, the issues with bites, but, if you try to touch any of the cats and they bite you or scratch you, then you get into this whole rabies quarantine issue. And you also don't wanna accidentally let one out, like while you're trying to touch it. If you open the back just to poke in at it or something, they could get out. And as I said, if they do get out, you might not ever catch them again. So even if a cat is like totally freaking out in the trap, just don't let it out. You just gotta give it some time and it will calm down. I've never seen a cat that was like persistently agitated in a live trap. And ideally, if you have a big group of cats that you're catching, you would like to try to catch them all at one time. That can be hard, because a lot of places can't take that many cats all at one time, but the more you can catch at once, the easier it will be, because you don't have to make multiple trips where you might be catching the same cats over and over again. Some cats are not smart and will go in over and over again. I mean, they've learned that there's food in there and that they're gonna get let out. So that's kind of a wasted trap if you just keep catching the same big tomcat repeatedly. Also the cats, most of the cats will learn that the traps are something to be afraid of, and so it'll be harder and harder as you have fewer and fewer cats to get fixed. So I think in terms of like how long can you keep a cat in a trap, you know, a few days if you have to. We work with a group in Bloomington who traps cats for several days beforehand. We work with a group in like Effingham, I think, Ears, and they plan for days ahead of time. There's a group in Decatur that plans for days ahead of time. So if you do have to, if you do have to house the cat for more than just 24 hours or so, that's where newspaper comes in. You wanna have newspaper that you can keep underneath it, and maybe some even in there that you can slide in and out. And that is where, trap fork? I didn't, it's in the front seat of the car. They make these things called trap forks or trap dividers, and they're basically.
Do you want me to run and get it, Sarah? If your car's
You can,
unlocked?
it's in Dina's van in the front seat.
What am I looking for?
It looks like a giant fork.
Yeah.
Okay.
Oh, let me grab it.
Okay, there we go.
Oh, it's locked.
I'm not sure if it is or not.
Let me try.
Okay, well, we'll come back to that. But the trap forks are good for if you're holding cats in the live trap. So really, the only time that you would really need to hold the cats in the live trap for an extended period of time is if you are trapping days in advance, because by the time they have surgery, you kind of know what you're dealing with. So if you've got to hang on to somebody for multiple days after a surgery, you're going to be better off putting them in a wire cage with something to hide in, like a hidey box. If you don't have a hidey box, a little cat carrier will work as well, because the cats will almost always just go right in that carrier. Feral cats are really good about using a litter box. We've placed about 800 cats with our barn cat program, and we've only had a handful of cats that persistently wouldn't use the litter box. And so, you know, these are cats that have never been in confinement ever, and they're using a litter box from day one. So, you don't really need to worry about like changing out towels and stuff too often. So the trap divider is great because it slides in here, and now you've got your cat over here, and you've got your back door, and you can put food and water in. You can slide, you can slide newspaper in there, and the cat is very unlikely to try and get out. So
What's it called?
it's a trap divider or a trap fork.
Okay.
Yeah, and I mean, if you have somebody that's good with metal, they can make you one, but we bought that. But those come in really handy if you get two cats in there and one of them's already ear tipped. You can, divide them and shoo the ear tipped one out the other direction, or maybe you've got a mom and a baby the baby's too small to get fixed. It's a good way to separate cats. Usually you're not gonna get 2 cats in there, but sometimes you do, especially with little guys that, kittens that go in at the same time. So, I'm gonna move on to medical considerations. These are the types of things that you are gonna run into in the middle of surgery. So this is really more like things you wanna talk out with your vets. So the first thing is pregnancies. We advise that you terminate pregnancies in cats, especially feral cats, because you all know that there are too many cats out there. And so if you don't terminate the pregnancy, then you've got to decide if you're gonna sit on this cat for several weeks until it has kittens and then sit on it for several more while the kittens grow. You definitely don't wanna let it back outside. I think that with feral cats, this is probably less of a controversial subject than it would be if you're talking with pet cats. But you also don't want to have a situation where your vet gets in the middle of a spay and they see that it's a 3rd trimester pregnant cat, and then they don't want to do the surgery. They stop surgery because the kittens can have brain damage from that. So you've got to have a plan for pregnant cats when you come in. We've had cats that came in for surgery that had kittens in our cat room as they were waiting to get spayed that day. So you have a plan for doing those cats first, maybe. It's unavoidable. There's also cryptorchid males, so male cats with 1 or 2 retained testicles. That can be a pretty involved surgery, especially if you're talking about a double cryptorchid, because they really might need to go in and fish around for those testicles. So the vets need to be prepared for that. That will probably carry an extra surgery fee, so you want to have a little bit of padding there in terms of surgery costs in case that happens. We hold everybody overnight and release the next day, pretty much regardless of the type of surgery they have. But we do, our vets are doing 60 surgeries a day, where most vet clinics are just doing a handful of surgeries a day. So the length of time it takes to do surgery does affect recovery to some extent. You'll run into a lot of abscesses and wounds, especially with male cats. So you want to have a plan for kind of checking over the cat and treating any abscesses or wounds. This morning we had a cat whose entire scrotum was rotten, like had rotted off, and his testicles were just there. So we had to do a scrotal ablation, which involves removing the scrotum, which is not normally what you do. He had wounds that we needed to close. He took a lot of extra time. So male cats like to try to bite each other in the testicles, so that's probably what happened, is that another cat was chasing him and got him, and it got infected. So, amputations like broken legs, degloved tails or broken tails, eye enucleations, those are all things that we do at the time of spay or neuter. There may be situations where the cat could recover from a broken leg if you put a pin in, or if you splinted it, but you have to really kind of consider whether you can do that. If the cat's handleable enough for you to do that, B, if you can afford for those services to be done. If those are not an option, take the leg off, give the cat a few days to recover, and put it back outside. Especially if it's a back leg, the cats just get around much better than we do if they're missing a limb. Same with eye removals, especially if you've got like a persistent eye problem that is likely to cause issues in the future. If the cat's super feral, you're probably better off taking that eye out than you are waiting to see what happens, because you hate to release the cat and then a few months later its eyes keep popping out. Yeah. So those are just the types of things you want to plan for. You want to use dissolvable sutures, because you definitely don't want to have to catch the cats and bring them back in. I feel like that's probably a given, but it's definitely something you want to talk about with your vet just to make sure. Another thing that I didn't mention before is tattooing the cats. In addition to the ear tip, we put a little tattoo next to the incision so that they're marked as having been spayed or neutered. If the ear tip was ever not enough to convince you that the cat was fixed, the tattoo will seal the deal on that.
But the hair grows back over it, right?
Yeah,
So
but-
only you would know when you get it on the table.
Right, yeah,
Yeah,
but it
I-
saves
I
you,
wouldn't,
it
yeah.
saves you from an unnecessary
Right,
surgery,
right.
so like, especially like,
Yeah, we do that for dogs, it's
Yeah.
kind of a common
yeah.
veterinary practice.
You tattoo them?
Yeah,
You
they,
do?
they do.
I didn't realize that.
Randy does.
Oh, Randy.
Cats that are fixed really young may have no real discernible space scar when they're adults. You know, if you're doing 2-pound kittens, they just may not have much of a scar when they're bigger, or it might look like the umbilicus. And so that green tattoo is clearly not there by nature. And so,
What is your requirement for kids? I always forget.
so we do generally 8 weeks and 2 pounds.
Okay.
With feral cats, we'll go down to about a pound. Because you've got the issue of like, are they ever gonna come back? This might be their only chance to get fixed, it might be their only chance to get vaccinated. If they're friendly and they're that small, we'll usually turn them away and have them come back when they're a little bit bigger. Most of the cats that we lose in surgery are feral cats, and they're not tiny kittens. It's like teenage cats. And I assume that it's more often ferals than pets, just because the ferals don't get a pre-op exam and they don't have any history, so nobody really knows if there's anything wrong with them. And then again, the vast majority of the deaths that we have are appear to be anesthetic deaths. We'll send them off for a necropsy, and they usually come back without any major underlying conditions, and so then the assumption is it was an anesthetic death. We do not give or recommend an antibiotic injection for all cats. We do it almost never. And that is because part of it is the cost, but the major part of it is just that it's not necessary, especially if your surgeon is fast. Rate of infection is directly correlated with the length of the surgery. So if you're doing a minute or two cat neuter and like a 5 or 8 minute cat spay, you're just not gonna really need antibiotics. If you have a longer surgery or something weird or an abscess, then you might wanna use an injectable antibiotic like Convenia. Convenia is kind of expensive. It's like $10 or $11 at cost. That's at our cost, at a discount, at a shelter discount, for an average size cat. So that'll help keep your costs down. And we don't see a lot of cats back for rechecks. We don't get a lot of reports of like post-operative deaths or anything like that. So then the next medical consideration that I want to go over is FIV and leukemia. And so we talked about this already. We do not recommend combo testing feral cats under basically any circumstance, and that is pretty common amongst your big like community cat groups. Alley Cat Allies doesn't recommend it. So FIV is found in 2 to 4% of the cat population. It is twice as common in males as it is in females, because males fight and they bite each other. And it is spread through the bite of an infected cat. So if an infected cat bites an uninfected cat, that's how they spread FIV. It can also be spread from mother to kitten, although that is not very common. Leukemia infects about 1 to 2% of the cat population, and leukemia is more risky. It is spread most often from mother to kitten or from friendly cat behaviors. So mutual grooming, sharing food bowls and sharing litter boxes. It is spread through the saliva, but it is very easily killed. You can kill leukemia virus with soap and water. So there are a lot of reasons why we don't recommend combo testing your cats. First of all, it's expensive. Yeah. And this is not, you know, obviously pet cats this is different, but first of all, it's expensive. We pay $14 for an IDEX combo test, and we charge $25 for a spay or neuter. So and we charge, when we do combo testing for shelter animals, we charge $19. So for the same cost of one surgery and one combo test, you could practically neuter 2 cats. So you've got the cost aspect. You've also got a low rate of infection. So very few of your cats, 2 to 4% of your cats are going to test positive for FIV, 1 to 2% for leukemia. So that means that 96 to 98% of your cats are going to test negative, and so you're paying however much money for the vast majority of those tests to be negative. And so if you're going to have 4 positive cats out of 100, is it better off losing all of that money or releasing those 4 cats that you know are positive? The other issue is false positives. When you're testing healthy cats, you're going to get more false positives than when you're testing sick cats, because the vast majority of those cats are going to be negative because they're not sick. So you would really hate to test a cat and it be positive and you euthanize the cat and actually it was just a bad test result. I think that's probably worst case scenario, is that you're euthanizing a cat for nothing and you just don't realize that you're doing it. Another issue is transient infections. You can see transient infections with both FIV and leukemia, and in adults and kittens. So a transient infection is a temporary infection. So the cat comes into contact with an FIV cat or with a leukemia cat, and they pick up that virus, but then they develop an immune response, and their immune system is able to fight off the virus, and they will then have future immunity to either FIV or leukemia. But before they fight off that virus, they're going to test positive. And so if you're euthanizing that cat for a positive test result, you may be doing that preemptively. So just like a false positive, it's a cat that could eventually clear the virus. You also see with kittens, especially with FIV, that kittens will pick up the FIV antibodies from their mother, but as they stop nursing and as they develop their own immune system, they will test negative. So the vast majority of kittens that test positive for FIV before 6 months old will test negative if you wait until they're over 6 months old. We see that in our shelter all the time. All the time. So the other issue is that this is unique to feline leukemia, but you can see latent leukemia infections. So in the last several years, Maddie's Fund has been doing a lot of research on leukemia in cats, and what they've found is that some cats will pick up leukemia and they will be persistently shedding the virus. So all day, every day, they're spreading that virus in their bodily fluids. But some cats will pick up leukemia virus and the virus will become latent and they will not be shedding the virus. So while the cat is not shedding the virus, it could be living with other negative cats and not be spreading it to those cats.
Can you explain that again? Because we're thinking that sounds like it's going to get spread everywhere. No. Help us understand that.
I will get there.
Okay.
So
Yeah, how you tell the difference, which is
sure, yeah.
spreading,
So you
which
you
is
can't
not.
tell the difference. But then I guess the next thing is that if these cats have FIV and leukemia, it's already there in the environment. Like if you euthanize the cats, you're really not doing anybody any favors because they're surely not the only cat in that colony that has FIV or leukemia. And so the odds of them spreading it is just not as good because a lot of the cats may already have it. The other issue is that cats that are fixed are much less likely to spread the virus. If FIV comes from fighting and you neuter male cats, they stop fighting. If it comes from mother to kittens and you spay the moms, they stop breeding. And so so just if you just don't test them at all, you don't have to worry about the cost, and your concerns about them spreading it is significantly reduced. There was a study of FIV of negative and positive cats living together in a shelter, and then another part of that study was living in a household, and they found that the negative cats were not spreading it to the positive cats. Sorry, the positive cats weren't, vice versa. There
I'm slow, but I was confused.
So that means that, if FIV is being spread from a positive cat biting a negative cat, if you neuter that cat and it stops fighting, it's gonna stop spreading it. Leukemia, I think, is a little bit more complicated because the cats don't live as long as an FIV cat would. FIV cats can live long, healthy lives. But again, you don't know if you've got a leukemia cat with a latent infection or a transient infection. And so many cats that do test positive are already asymptomatic and will be asymptomatic for a number of years. It's just, it's better for the cats and it's better for your budget if you're not doing combo testing.
Is there any risk at all, ma'am, of human contact or scratching, biting, or anything like that? Has there been anything done to show?
No, not with
whether it has
FIV or
any
leukemia.
effect on humans at all?
Yeah, no, there's no,
If they
it's
scratch and
not.
draw blood, it's not.
It's not
communicable?
zoonotic in any way.
Yeah.
That's good,
Yeah.
we're safe.
And it's, it doesn't go
Yeah,
to
'cause I was worried
dogs,
about
so.
that too.
Does anybody have any questions? Did I cover your,
I did,
Yes, ma'am.
cover
Yes,
it.
ma'am.
Okay.
Well, I think the part that was kind of confusing, I'd heard it before, but, when you say the positive leukemia cat is put back out there, and, oh gosh, he's gonna infect everybody else, I mean, that's the common thinking.
Sure.
So, but the reason, if he's spayed, then that's gonna cut down on it immensely.
Because they're not gonna be spreading it from the mom to babies,
Right.
because there are no more babies, so.
And then you talked about actually the immune systems, the leukemia's out there, but then some of the cats become immune to it
Yeah.
because of what's in the environment.
Transient infection.
Transient infection.
Yeah.
Interesting.
Yeah.
So in a feral program where they're doing the trap and neuter, it's not common practice for you guys to do the leukemia testing because it's too expensive.
Yeah, not just, but that is one major component,
It's kinda
but also
redundant.
all
It's
of those,
kinda-
also all of those other things, is like, given all of those other things, is that really how you wanna spend your money? And, given the low percentage of cats that will test positive, and then given that
And the
a
false
proportion of,
positives too.
proportion of those cats that do test positive, if you euthanize them, is that the right decision?
So the money could be
And-
used someplace else.
So much, if you can neuter a whole other cat with the cost that would be for combo testing, like, you're gonna do so
We
much more.
could probably do way more than one cat.
Yeah. So your money will just go a lot farther, and, maybe you can do, maybe you can fix 3 cats for the cost of one combo test and neuter together. And you're gonna do so much more for the cat population by neutering 3 cats than you are by neutering and testing 1 cat.
So is this a
Very
good place for
interesting.
you to tell us a little bit about your FIV leukemia rooms, or would that, you'd rather do that later?
We can kinda do that at the end.
Okay.
Because we don't test any feral cats, so we don't, the only time only time that we test feral cats is if we get a cat that comes in and, it is in seriously bad medical condition, and we're trying to determine whether we should euthanize the cat or whether what's going on is treatable. Cancer is more common in positive cats. Oral issues are more common in positive cats. So if we see a cat that's in really rough shape and he's got a real nasty mouth, if that cat is FIV positive, he's gonna have a nasty mouth forever, and it's gonna give him he's gonna have a hard time eating. He's gonna suffer and die. But healthy cats we do not test. And if we did see a cat that was in really bad shape and we did test it and it was positive, then we would euthanize the cat. That would be our goal, is to determine whether we were gonna euthanize the cat or not. And that happens every once in a while. It's not very often, but.
Has there been any studies done, anything that has identified environmentally or otherwise the source? Or is it just pretty much luck of the draw and lottery?
I know that they find FIV in African lions. They identified FIV back in the 80s, and there are several different strains of it. I don't know.
I used to raise Siamese show cats.
Yeah,
I
yeah.
lost two of them to that,
Yeah.
out of the blue. So,
Yeah, I
and a
mean,
very clean house, so I couldn't figure out where in the world the source would have been.
sure, yeah, it just has to, it must just be like cat to cat, you know? It doesn't
That's the thing, we
live-
didn't have any other cats, and the cat was an indoor cat that
Yeah.
went outside, so
Yeah,
I
it
couldn't
could have-
figure out.
FIV vaccines will cause a cat to be persistently, it will persistently test positive. There is a way to distinguish, the test isn't on the market, but there is a way to distinguish between a positive cat because it was vaccinated or a positive cat because it actually carries the
So there's no
virus.
common denominator though, as far as source.
Yeah, just, you know, FIV doesn't really live in the environment the way that leukemia does, but again, leukemia is very easily killed with just soap and water, so.
Okay, thank you.
And FIV cats can live with the negative cats, the positives and can live with the negatives, right, without them
They're
causing harm.
yeah, so I mean, it is still possible to spread it if they bite, especially like in the study that they did in people's houses and in the shelter. It was on a small population of cats. So if you've got 10 cats in your house, you probably don't want to take home an FIV positive cat. Or if you have cats that fight, you probably don't want to take home an FIV positive cat. But in small numbers of cats who aren't fighting and are like cohabitating well, it was not spreading.
With the Luke is a different story.
Yeah.
Completely.
Yeah.
I have another question too. If you're trapping cats and they have like mild upper respiratory symptoms, you know, the crusted eyes and nose a little bit, are you okay with going ahead and spaying them?
We usually do. We get a lot of upper respiratory infection in the cats. I mean, especially if you've got big colonies of cats, it's just unavoidable. If you've got kittens, you know, the more kittens you have in the mix, the more illness you have in general, just because the adult cats can fight it off better. If it's severe upper respiratory infection and they're friendly, then we will sometimes send them home. Sometimes we'll send them home with meds. If it's severe upper respiratory infection and they're not friendly, we'll isolate the cat and we'll do it last. And again, the cats that are dying are not usually dying from that. They're dying from, you know, anesthetic deaths. So sometimes we may give a convenient injection if they have really bad upper respiratory. Anecdotally, convenient can help with upper respiratory infection, but it's not really meant for that. You know, antibiotics don't treat upper respiratory infection very well. And the ones that do, you have to give orally once a day or sometimes twice a day. So.
I used to trap out at Hannon Trailer Court, and dozens of those cats, almost every single one had upper respiratory infections because they just spread it.
Sure, yeah.
The time.
Well, they may have had a version of, you know, chronic like herpes virus, and it's one of those things where once you got your hands on the cat, do you really want to let it go? And if you do try to hang on to the cat to clear it, you may be causing enough stress that it lasts longer than it would if you just let the cat back out. So, any other questions about medical stuff? Okay. So then after surgery, you probably want to hold the cats overnight. We recommend that you hold the cats overnight. They can't regulate body temperature the same day of surgery, so you want to keep them warm. If we do release a cat the same day, we tell people that they need to keep it in their house, or if they have like a legit heated garage, yeah, but not just like, well, it's indoors in my garage that's not heated, because you don't want the cat to get hypothermia and then die overnight. So you want to put the cat back in the trap that it came in. That's really your easiest thing to do, as opposed to putting them in a cat carrier. It's going to save you on cleaning. So just put it back in the trap that they came in, put some newspaper in the bottom or a pee pad. We do both. And then once the cats are starting to wake up, you can use your trap fork to block the cat off and slide a little bit of food and water in there. We don't always give the cats water because cats don't drink a ton of water and they're getting released the next morning. But you definitely want to give them some food. That'll help get their blood sugar up. A lot of the cats start eating as soon as they start becoming conscious. You want to make sure that you're keeping accurate medical records. If you're ever going to write a grant someday, you're going to want all the statistics that you can gather. So think of any kind of record you can get: age, color, sex, breed, whether they were pregnant,
Location.
location, whether they were pregnant or in heat, zip code, maybe, if you want to get really into it, you can map like latitude and longitude or put it on like a GIS map. But what we have found in our years of
I'm scared. I'm scared.
If
Our grant lady
you,
won't talk to us
if
again.
if you think that you might write a grant someday, you want all the data you can get. When we first started, we could get PetSmart grants really easily, and then PetSmart changed hands, and we had to try a lot harder. And that really meant kind of targeting specific areas of where cats were a problem, and so you'll be thankful that you kept all that data in the end someday. So hold the cats overnight. You want to keep them warm, keep them quiet, keep them covered, and do the food and water. And you want to make sure that before you release any of the cats that they're fully conscious and that they're clear-eyed and alert. You don't want to release a cat that's going to stumble off and get eaten by a dog or stumble out into the street or something like that. When you go to release the cats, you want to just set the trap down and open the door and kind of slowly peel back your towel that's covering the trap. A lot of the cats will just shoot right out of there and then take off. And then hopefully that is the last time that you have to encounter that cat. So, revaccination is something that you might, consider at some point. Some people might want to do that. We don't have very many of our TNR clients that do that, but if you wanted to revaccinate the cats in a year, that's always a possibility. That second vaccine would be a 3-year vaccine. So that's the benefit of revaccination, is that you get that full 3-year effect, and it's legally valid too. So that's kind of.
Sarah, can I just ask for clarification then?
Yes.
So, if you guys give the FDV,
FDRCP.
yeah,
Yeah, and we give
I've
a
asked you that
rabies.
10 times and I still don't have it right.
We give a rabies vaccine too.
The rabies and that second one.
We use a 3-year rabies vaccine. Under the law, they have to be vaccinated at 4 months and then again within 1 year. So under the law, even if you're using a 3-year vaccine that first time around, it's only good for 1 year. But in order to get those 3-year labels, those vaccines had to go through rigorous testing, and they had to demonstrate that the vaccine was good for at least 3 years. So we use a 3-year vaccine standard. It costs the exact same amount as a 1-year vaccine, so we really have nothing to lose by doing that, and it offers some added protection since the cats probably won't be caught again. And we also give an ear mite treatment. We use something called Dectomax, which is actually like a livestock product, but you just put a drop in each ear and it will kill ear mites. We offer additional services of flea treatment and deworming, injectable deworming if people want to do it. Sometimes if they have really bad fleas or worms, we'll just do it because we need it, even if they didn't ask for it. You don't see a lot of really bad flea problems in outside cats. Healthy outside cats can usually manage their parasite load pretty well. So unless they are compromised for some reason, or young kittens, we don't.
Kittens.
Yeah. So
Yeah.
for adult cats, we don't really recommend doing deflea and deworming standard. That also just adds to the cost. And if they're just gonna get reinfected next month, what is, if they got a couple fleas, are you really helping them out? Is it really worth it? Any other questions?
That's it for me.
Yes.
The laws are changing constantly, quickly. Where cats now, beginning January, have to have the rabies shot. Is that every year? And or every 3 years?
Sure. So, that owned cats, companion cats, are required to have a vaccine at 4 months.
Right.
And then again within 1 year.
Okay.
And then after that, it can be every 3 years.
Okay. What happens if you don't get the rabies shot?
For your pet cat, well.
And it gets rabies.
Oh, and it gets rabies?
And it gets rabies.
So probably,
It's inside.
if your cat gets rabies, then,
And or dog for that matter.
sure, yeah. So, my understanding is that all of the animals in the house, are suspected of rabies, and they either have to go through a pretty lengthy rabies quarantine process, or they may be forced to be euthanized and checked for rabies. and anybody potentially exposed has to go through rabies exposure treatment. Rabies in cats is really rare in Illinois. There was a case a year or two ago up north, but it's really not common in cats. It's almost exclusively seen in bats. So if you've got a bat problem, make sure and vaccinate your cats in your house.
Not your
Really
bats.
Vaccinate your cats, yeah.
Not your bats.
Yeah, you ain't gotta
Yeah,
vaccinate
you
the
can't
bats.
vaccinate- I think your convention's
Is
got
there-
vaccinators,
is
they'll know
there-
about bats.
Is there anything, if you don't have insurance on your car, and you get caught without insurance on your car, there is a fine and there's serious repercussions to it. So if you're supposed to have these rabies shots for dogs and cats, and you don't do it, what's the penalty?
So I don't think that there's a penalty under the state law.
Here's what they told me. Okay, and this was Decatur, the gal called and said, hey, I need a record of this dog's vaccination. I'm like, lady, I don't carry that. What do you mean you don't carry that? Well, I don't carry that. I don't do that, you know. And I've been at this 18 months, okay, so I'm kinda green and everybody, she says, honey, that's your money. Because when you find out that this person hasn't done that, you send them a ticket. Which advises them, you know, and that's $75. So technically, you could get a ticket for that.
Okay.
Doesn't it depend on the county?
But that's not really you guys' deal, is it?
Even townships, I think,
Yeah,
are
we-
different.
we-
For sure,
we
Mulcher
can't-
County.
We can't
Yeah.
get tickets or citations
Right.
or anything like
Yeah.
that, that has to come from the animal control
Yeah.
facility, and I think it is different from
If
county.
they do happen to be
Yeah.
brought in here as a stray, they have to show proof.
And I guess
Or
what
they-
I'm getting back, you're talking about microchipping these feral cats. And if you gave them the rabies shot one time and didn't give it to them anymore, and then the cat become rabid and bit somebody, and they went to the microchip and found out it was your cat,
Sure.
and you let it get the rabies because you didn't catch it the second time.
Oh, could there be like a liability issue there?
Yeah.
I mean, you know, people can try to sue you for anything, but it's not your cat.
No.
Like it's not
your
you know,
cat.
Yeah,
It's-
it's not your cat.
It's a
Yeah.
community cat.
It's
Rabies.
just- yeah.
Feral
Yeah,
cats.
so rabies vaccines, they provide immunity much longer than they're labeled for, but you have to pay a lot of money for those types of labels, so. Feral cats that are not part of a TNR program or that are not being presented to a vet are exempt under that law. Leedy Van Cabbage, is an attorney who works with Best Friends, Animal Society, the big national group, and she's a lobbyist here. And she makes sure that the feral cats are taken care of under the law, so, that exemption is there because of her, so.
So it's kinda like when you hit a deer, let's say you can't sue the state.
Right, yeah. So, I mean, people can try, but it's probably not worth the money to try. And, you know, if there is a cat bite, that is one of the benefits of a microchip. If there is a cat bite, you can look up and see when the last rabies vaccine was. The cat that we returned that I said had been to animal control 3 times, he was at animal control the last time because he bit a kid, and so we knew when his rabies vaccine was, we rabies quarantined him, we vaccinated him again, and then back home. So.
Back to bite again.
Well, it was a friendly bite.
Oh, they all
Love
are.
bite.
Most feral cats are just gonna avoid you like the plague, but this guy was quite friendly and had a couple of different caretakers, so.
Had that. Sarah,
Yeah.
did you say that if an animal has been exposed to rabies, there is a post-exposure treatment for them? There is for dogs
There's
and
not,
cats?
there would be for any people that were exposed, but my understanding is that they actually will just impound your animals and euthanize them and check for rabies.
There was a case where a bat bit a dog, and that dog had to go under examination for 6 weeks. And then after that, and I don't know if there's some kind of blood test or if they have to kill them or just what, but they had to sit for 6 weeks, and that come from Department of Ag.
Yeah, so I think it would
So-
probably depend on the situation, but I think they can
If the bat
probably-
tested positive or something like that, then
Yeah.
yeah.
Yeah, I mean, I think worst case scenario is that you've got a whole bunch of pet cats and you get a rabid bat in your house with a confirmed bite, and then, you either have the expense of quarantining the animals for a significant period of time, or you have to euthanize them. The only way to check for rabies is to dissect the brain, so, unfortunately, there's no live test for that.
Did someone just call you about a bat?
Yeah, bat bit their cat, and they took the bat in and have it checked. And, the bat turned out to be non-rabid, so.
Okay, okay.
Yeah, the vast majority
Yeah.
of rabies tests that the state does every year are
I didn't know
negative,
if I
you know,
dreamt
but
that or I-
rabies is such a, rabies is such a huge concern that they take it very seriously. Any other questions?
Did you have another trap?
Oh, yeah, I do. Oh, and also, I brought, Sally, you had mentioned bringing, like an easy to make cat
Oh,
house.
yes, cause I
And
know
so-
Vince is gonna, he wants to have a class in a couple weeks where people will bring their supplies and we can make a bunch of feral cat
So,
houses, so.
I took this right out of our feral cat enclosure this morning because nobody was in it. But we have 10 barn cats right now in our outdoor enclosure that are waiting for a barn home. And we keep cats out there year round. The cats are used to living outside, so they fare well. But this is one of the donated cat houses that somebody brought to us. It doesn't, ideally it would have a lid, but I usually just throw a blanket or something over it. This actually has 2 openings on it. So if you're somewhere where there are coyotes or like a lot of stray dogs, you might want to have like an escape hatch for your cat houses, because you really don't, you want the smallest opening you can for the cat to get in, because it'll keep other like bigger animals out.
And keep them warm.
And keep them warm. So the downside of the 2 openings is it's not going to keep them as warm. We have one that somebody made for us out of like a big Coleman cooler, and they put like a flap on the escape hatch and then like a PVC pipe around the opening. And that one's really cool, but obviously way more expensive, and you need way more skills than I have to make it. So this actually, you can just take the lid off and then we just fill it with straws.
Oh, that's like insulation.
Yeah.
Styrofoam cooler, or people
Yeah.
donate these Omaha steaks.
Yeah.
You like get frozen food or whatever, they donate the containers to us.
The ones that come with the vaccines that we order are a little bit bigger. And we've even just like taken the cooler itself and not even put it in anything, and you just tape the top on and cut a hole and fill it with straw, and the cats like them. So this one we have in our enclosure where it's got some stuff draped over the side of it so that it can kind of keep the warmth in a little better, since it's got those 2 openings. But this is a nice and easy and cheap, especially if you don't need a lid. A lot of people have these with no lids. We have 50 of them in our garage right now.
We've got Boy Scouts that want to make a project for you, or school groups. This is a great project for kids.
Yeah, or even they can make dog houses. We get donated dog houses, and probably half of them go to cat people that have outside cats.
Yeah.
Styrofoam works really well. Straw is better than blankets because it doesn't hold the moisture the same way that a blanket will. What we do notice is that as the weather gets nicer, the cats start to poop in the straw, and so that's when we start finding poop in the straw, we know it's time to get rid of the straw. So it took me a few months to figure out that's what was happening. Okay, so I am gonna show you the drop trap because it's really neat. We got 2 of these donated, and the handful of people that have used them were immediately successful. And so this is great for hard to trap cats. It's not super great for cats that are really feral, but if you've got cats that are willing to eat around you and just won't go very close to you, this is a really good solution. So it stores really nicely inside of itself, but it got bent up a little bit. Okay, so
Thank
As
goodness.
we talked about. Okay. These are kind of expensive. I think they cost like $150 or $200. So you don't want to have a lot of these, but 2 is great. You can also make these. You can find blueprints to make these out of like wood and like mesh or like screen. You do not need anything this fancy. So you hold
A
this.
drop trap?
A drop trap, yes, and you will see why. So,
I'm kinda guilty.
so this is, it's something that you are going to prop up, and then when the cat, you're gonna tie a string to it, and when the cat goes under it, you're gonna pull the string and it's gonna drop down on them. So, that's why it's called a
Wait a
drop
minute,
trap.
where are you hanging it at?
I will show you.
Oh.
So, you wanna take this out. My lovely assistant. Alright, so this that was the case is also the roof. And so they did a really good job at designing this. So, you put the roof on, and then you will see that there are these bungees all around. So you're gonna wanna bungee roof on.
So we're gonna get several this way?
You can. You definitely can.
Probably anybody around the food bowl.
Yeah. We don't have to bungee all of them. Just enough to like,
Well, at this point, we've got
get the gist of it. Okay. Now you want to take your door and just slip it.
back in.
Yeah.
I probably did.
All right. And then, so you're gonna want to put this little flat piece right here. You want to put something heavy on this. This is gonna stabilize the trap. And when you're doing this on concrete, it works a lot better, or grass, because it's not gonna slide around as much. So we'll just pretend that there's something heavy on that. And yeah, you can. And then right here is your prop bar. You're gonna tie your string to that. And so now what you do is you put your food back here so that the cats are as far away from the falling part as possible. And then you wait for your cats to go under. And maybe you just have one that you're trying to get, or maybe you've got 5, maybe you get all 5 under there. You can make your string as long as you need it to be. But, you know, the shorter the better, probably, just in terms of like ease of seeing the cats. So once you get your cats securely under here, you're just gonna pull the string and the trap's gonna go down. So now the cats are gonna go totally crazy and just, you know. But that's all, you know, that's all you can do. So in the documentary where they use these, the ladies are waiting and they run up with a sheet and they cover it really fast, which is good because it'll help keep the cats calm. So you wanna cover it once you catch the cats. So now you've got like maybe 5 cats in here, and how do you get them out? So this is where your bungees are gonna come in handy. And this little guy, you can buy separately, which is essentially half of a live trap. So this actually,
By the door.
yeah.
Okay.
So, and then you can you just bungee it to the little crate.
See, anybody can make money, you just have to be creative.
And then, you know, this lifts up and this lifts up. Wow. And so then you just gotta kind of shoo them in there. Let's say you have somebody you don't want, you can get them in there and then just close everything back up and release the cat. Or you can pull them out one at a time. You can get them in here and just use this as your carrier. You could put a live trap up to it. You could put an appropriately sized carrier up to it. Obviously, if you're using a carrier, you run more of a risk of losing the cat. But if it were me and I was using a carrier, I would use something like this to block the door of the carrier off until we can detach it and then shut the door really quickly.
Do not recommend using that
so.
for grandchildren.
But,
We have 4 and 5 years of age, I'm seeing all kinds of ideas here.
Mark already talked about it being for daycare,
So, yeah, so this is just a really cool thing that we got not too long ago, and I'm really excited
Sarah,
about it.
so with the string part,
Uh-huh.
the cats that are hanging around, you have to be around.
You gotta be there.
And so the completely, like you, I think you said earlier, now I see why, you said the completely feral ones that won't work for. Because you have to kind of be.
Right, that's when you probably want a longer
Okay.
string.
What if you put a counterweight on it, attach it to the food bowl, and as they eat the food, the bowl got lighter?
That might work, you could definitely
I'm
get
sorry,
creative.
that's
But I mean, you can see how you could make something like this if you even had like minimal carpenter skills, you know, you could make something like this and it would be lighter weight and, you know, you just make most of a box and put a stick on it, so.
But that part is the main thing, the
Yeah.
prop.
Yeah, yeah. So there's a documentary called The Cat Rescuers that was released earlier this year, and it's all about people who rescue cats and do TNR. And she had one that she had made herself. It was really neat. So.
Cool. That might be an idea. I mean, do you have some good sites if people want to go on and learn about all this? I mean, I'm sure we can all Google it, but.
Anything that Alley Cat Allies is gonna link you to is gonna be.
Yeah.
Alley
Alley
Cat
Cat
Alley.
Yeah, Alley Cat Allies is great. Neighborhood Cats also, they do more like on the ground stuff, I think. Alley Cat Allies is so big that they're doing a lot of like advocacy as opposed to like going out and trapping. Whereas Neighborhood Cats is a TNR group in New York City.
I thought it was in New York.
Yeah, yeah, and
I've been on that side before.
yeah, yeah. So they have, I mean, Alley Cat Allies is great, but I think Neighborhood Cats has a lot of like hands-on tips.
In New York City, they use those for rats,
Yeah.
which are the size of small dogs.
Yeah,
Kid
I
you
don't
not, sewer rat? Yeah.
So I'm not
I've been
gonna
to New
put
York
this
City.
away in front of you because it is much harder to put away than it is to hurt. But
I have a question about your barn program or whatever it's called.
yeah,
Do you ever take other people's feral cats
we do not.
and relocate them to barns?
Yeah, we do not, and that is because there are so many cats at animal control that animal control wants us to take.
Oh, I see.
That if we did that, then those cats would be dying at animal control.
Right.
And so, you know, we talk to people like at least once a week who are like, I just gotta get rid of these cats. And I mean, unfortunately, the only real option is you do TNR and you kind of play the long game, or you remove the cats and euthanize them, and that's not, you know,
Right.
not anything that we recommend. So.
But I guess my question is, there'll always come up somebody, oh, we can help you get rid of your cats. There's a farmer out here that wants your cats.
Mm-hmm.
Well, I think that's all well and good, but my understanding is if the farmer who takes them is unwilling to at least feed them for a while, they're not gonna be there. They're just,
Yes.
they're gonna get scared, they're gonna run out, they're gonna end up dying because
Right.
now they've been fed.
Yeah.
And they don't even know how to hunt, most of
yeah.
these feral cats.
We require that people feed the cats. They have to commit to feeding the barn cats, and they have to commit to keeping them confined for at least 2 weeks before they let them
Okay,
outside.
2 weeks, okay.
Yeah, at least 2 weeks. Because the cats need an acclimation period,
Well,
or
they do
they're
better
not gonna
in
stay.
pairs too, don't they?
We do them in
Or, you know,
pairs. Yeah.
Litter mates.
Yeah, yeah. We try to keep them together. Like, we look at the admit paperwork from animal control, and if it's from the same address or the same city, we try to keep them together. And we follow up. We do follow-up surveys, and about 2/3 of the cats are still there at the 3-month mark, and about half are still there at the 1-year mark. And there may be more that are there. They're just
Yeah.
not seeing them because they're more often nocturnal, especially like seriously feral cats, or you know, you're just not going to see them as much. So, you know, some of those cats have died, but they didn't die as soon as they would have if they stayed in animal control.
Right,
So-
right. Now, Vince, do we ever get any calls for people asking, like farmers asking for
For barn
cats?
cats, yeah,
Yeah.
we've I've gotten a few. What we've done is I took a bunch to the vet and had them spayed and neutered, and then sent them out there, and I think they're mostly still there. You know, of course, he feeds them
Right.
and keeps the litter box for them in the barn, and you know, I've had a couple of board members, you know,
Couple board members that have
yeah,
taken the
Chad,
cat.
Chad Michael
Nice.
and his dad, and then Phil Snyder and his dad have done barn cats, and
Good.
that's what we've done
That's
for
a
them,
good thing,
so,
you know?
and they seem to stay around, yeah, they keep it. Thanks.
I can talk more about our barn cat program if you guys are interested.